I'll begin by verifying the healthcare provider's orders. Then I'll verify the 6 rights of medication administration, which are right patient, right medication, right dose, right route, right time, and documentation. Then I'll check the medication orders in the MAR, making sure that comparing the MAR to the names of the medications on the medication labels and with the patient's name on them. So the MAR has the medications and the doses, and these medications have the same names and the correct dose for this patient. These medications are for MAR 3. There are 5 of them. They are scheduled to be taken at 1900 or 7 p.m. I apologize for the open medications from previous video practicing. I'll proceed as if they're not open. The first medication is amoxicillin for 250 milligrams. The second one is metformin for 500 milligrams. The next one is phenytoin for 100 milligrams. The next one is ferrous sulfate for 65 milligrams. And the last one is acetaminophen, 500 milligrams per 15 milliliters. Once I've collected the medications, I'll proceed into the patient's room, close the door for patient privacy, perform hand hygiene, and apply clean gloves. Oh, I apologize. Perform hand hygiene and introduce myself to the patient. Hello, Mr. Smith. My name is Bessie. I'll be your nurse. May I see your wristband? Thank you. Can you please tell me your first and last name and your date of birth? Thank you. After I've verified my patient, I'll check the MAR again, checking the medications and the doses that I have to the medication orders in the MAR with the patient's name. After I complete that, I'll check if my patient has any allergies to certain foods, medications, seasonal, or any others. No? Okay. Then I'll perform hand hygiene. Now apply clean gloves. I'm now at my patient's bedside. I will check these medications for a third time against the bar. Again, name, dose of the medications to the name and dose of the medications with the patient's name in the MAR. All is good. All right, Mr. Smith, I'm going to do some pre-administration assessments for these specific medications. So for amoxicillin, I want to check his temperature, blood pressure, assess the skin for any rashes, check for any signs of nausea, vomiting, or diarrhea. For metformin, I also want to take his temperature and blood pressure. I also want to review his creatinine levels, and I also want to, after the creatinine levels, also assess for any signs of lactic acidosis or hypoglycemia. For phenytoin, I want to check his blood pressure, check his blood glucose levels, and check for any signs of skin lesions, assess the skin. For ferrous sulfate, I want to check his blood pressure, check basic lab values, assess for any fatigue or fluid retention. For acetaminophen, I want to again, check basic lab values, assess for any signs of liver complications or abdominal pain. After I've completed the pre-assessment, I'll continue with my patient. Okay, Mr. Smith, it's time for your medications. You have 5 medications. I'm going to review each one with you. I'll review what they are, what they do, common side effects, and adverse effects. Now, adverse effects are really important. They require immediate attention. If you experience any of these effects, these symptoms, please report them immediately, okay? All right. So the first medication you have is amoxicillin. It is a 250 milligram capsule. And what it is, it's an antibiotic for bacterial infections. It works by stopping the growth of bacteria. Common side effects are nausea, vomiting, diarrhea. The adverse effects are difficulty breathing, anaphylaxis, or hypersensitivity. The next one is metformin. It's in for 500 milligrams. It's a tablet. It's an anti-diabetic used to treat type 2 diabetes mellitus. This works by decreasing glucose production in your liver and improving insulin sensitivity. Common side effects are nausea, sometimes abdominal sensitivity or discomfort, sometimes a metallic taste in the mouth. Adverse effects are hypoglycemia or lactic acidosis. The next one is phenytoin. This is a 100 milligram tablet. This is an anticonvulsant. It treats and prevents epileptic episodes or convulsions. It works by slowing down certain electrical signals in your brain to prevent seizures. Common side effects are headache, drowsiness, sometimes sore, swollen gums. Some adverse effects are irregular heart rate or difficulty breathing. Or sometimes severe skin rashes, lesions, or blisters. The next one is furious sulfate. This is a 65 milligram tablet. Tablet. Last one was a capsule. Tablet. This is an iron supplement. It helps prevent or treat iron deficiency anemia. It works by providing the iron necessary for your body to make hemoglobin and help promote oxygen throughout your body. Some common side effects are nausea, constipation, diarrhea. Now, adverse effects can be fluid retention or irregular or difficulty breathing. The last one is a liquid medication. It's acetaminophen, 500 milligrams per 15 milliliters. For your dose, you'll be receiving 15 milliliters. This medication is a pain reliever for mild to moderate pain. It is also a fever reducer. It works by inhibiting certain compounds in your brain that are involved in pain perception and and temperature regulation or fever regulation. Common side effects are headaches, sometimes abdominal pain. Some adverse effects are complications for liver failure or unusual bleeding or bruising. Do you have any questions? No? Okay. So I'm going to sit you up in a comfortable position. Do you prefer to take these medications all at once or one at a time? All at once. Okay. I'll put them in this cup for you. And I'll have my patient the cup to take the medications and a cup of water to drink that down. After he's done taking those medications, I will prepare the liquid medication. To protect the label integrity, I'll hold the label against my palm. I'll thoroughly shake this liquid medication before administration. Because it's a multi-dose bottle, I will remove the cap, making sure it's facing upward on a flat surface. Then I'll pour to the 15 milliliter line. After I've poured the medication, I'll take a paper towel, wipe the lip and neck of the medication for any excess medication, dispose of this in the proper receptacle, and recap the bottle. I'll then give the medication to the patient and give him a glass of water to drink that down. After he's done taking his medication, I'll make sure he's in a comfortable position, make sure the call light is within reach, dispose of any trash in the proper receptacle, remove my gloves, dispose of these in the proper receptacle, perform hand hygiene, and document the procedure.